If you could, Jerry, can you tell us a little bit about what things were like before going to see Dr. Barbanel and getting your dental implant?
Well, I was missing some bottom teeth on the right side, and I had a partial. I had a couple of partials. I was on my second partial, and it was just too uncomfortable.
Just didn't work out for you?
Mm-mm. Put it in the drawer and just never wore it. And I went to Dr. Turner, and Dr. Turner, in cleaning my teeth, had noticed that he suggested I should go next door and see Dr. Barbanel for periodontal disease. Mm-hmm. And I went next door and I talked to Dr. Barbanel, and we arranged to do gum surgery. And after the gum surgery, he had mentioned to me that he could put implant in, and that way I would do away with the partial. At this time, I noticed my teeth separating and everything, and I knew that I had to do something. And so at that time, we went back over to Dr. Turner and had him look at it after Dr. Barbanel explained what he was thinking on doing, and Dr. Turner agreed that he could build a bridge on there, and so we went ahead with the implants.
I understand that Dr. Turner built the Vincent Thomas Bridge here too as well.
Very possible. He does good work.
Just kidding, of course, but it's interesting that Dr. Turner worked closely with Dr. Barbanel in this procedure, because really, as I understand it, all Dr. Barbanel did was put the implant in, and the cosmetics and the function of your implant is really due to Dr. Turner's work.
That's correct.
Mm-hmm. Because Dr. Turner put the permanent bridge on the implant.
Mm-hmm.
Great. Tell us a little bit about the difference between having your dental implant and your partial dentures.
Well, the partial, even when I would wear it, it would rub on my gum and make a sore on my gum. That's why I just stopped wearing it. And what would happen when I didn't wear it was I'd have to chew on just one side. Mm-hmm. With the implants, it's a carefree situation. I brush them every day just like normal teeth, and I can chew on both sides again, which was a real pleasure after being without teeth on that one side for a long time.
Took you a while to get used to the fact that you could chew on the other side.
Yeah,
mm-hmm.
And with the partial, even when I did wear it, I'd have to take it out after I eat and rinse out my mouth and put it back in. And with the implants, I don't have to do that.
Great, great. You've got two implants in the back of your mouth.
Yes.
And they're anchoring a fixed bridge.
Right.
This bridge is not a large, it's certainly not as large as your partial was.
No, it isn't.
No, so it doesn't get in the way, it functions fine.
Great.
It doesn't affect your speech at all.
No, it doesn't.
Great. So your lifestyle is just as carefree as it can be.
Yes, except I eat better now.
Well, that's good. Look at the smile, by the way, and that's a heck of a smile you got there.
Thank you.
And the camera never lies, you know. So we've got a good handle on what Dr. Turner and Dr. Barbanel have done for you. If somebody were to ask you, you know, what you would recommend, and they were in a similar situation that you were in, you know, dealing with a partial and fumbling with it and not being happy with it, what would you tell them?
I'd tell them that they should go for implants. And I'd also recommend Dr. Turner and Dr. Barbanel because they're the two most caring people I found in the field.
What about the cost? Was that a factor at all?
At first, when they told me how much it was, you know, I thought about it. And when you compare it to what the denture costs, the partial denture, it wasn't anything. Because, like I say, I'd gone through two partial dentures, and neither one of them were comfortable. And it would have been less money if I would have just gone with this in the first place, if I would have known about it.
Oh. So if you could have avoided the partials altogether, and you could have saved money by going with the implant first. Mm-hmm. Mm-hmm. Great. And I assume that you consider it an investment in yourself.
Oh, yeah.
And you're worth it.
You better believe it.
Jerry, if you could, be honest with us and tell us if you really had any pain after your implants.
I had some pain, but I found that all I had to take for it was some extra strength Tylenol. And they'd told me beforehand that there would be a little pain, and I was expecting much more pain than what I had. I expected I'd probably have to take implant codeine or something like that, and all I had to take was the Tylenol, and that's all. That's all I ever took for it.
Great. Was pain an issue for you at all? I mean, did pain have anything to do with you not getting implants sooner? I mean, were you
No,
afraid?
I didn't.
Were you afraid at all going into this?
No, I didn't know about implants beforehand, and I think the partial caused me in the long run a lot more pain than it was just to have the implants put in.